Welcome to the very best part of my broadcast week. We've had many, many guests on this program over its now 8 years. We have had no guest more frequently on this program than the one we have this week, Dr. Anthony Fauci. For obvious reasons, we had Dr. Fauci 3 times during the COVID-19 pandemic. We had him on earlier than that, much earlier, February of 2018, my notes tell me, from the Tasty Diner in Maryland. I'm going to show you a little picture of that. We'll put that up so everyone can see it who's watching on Paramount Plus and on CBS News 24/7. That was to talk about flu and flu vaccines and Dr. Fauci's experience dealing with Ebola, Zika, AIDS. We're going to get into that because Dr. Fauci has a best-selling book titled On Call. Dr. Fauci, great to have you back on the program.
Thank you, Major. Great to be with you. Thank you.
You write in the book, Dr. Fauci, about regular interactions with President Biden, and you talk about frequent phone calls you got from him, his level of curiosity, the depth of his understanding of the underlying issues related to COVID and everything else, his curiosity, the questions. Simple question. Did your interactions with the president in any way resemble what you saw in the debate performance last Thursday?
No, I mean, obviously not. I don't want to comment about what happened that night, but, to me, it just looked like a bad night because my interaction with him was what I describe in the book and what happened even subsequent to what I described in the book after I got out. He's very probing in his questions, very analytical, very calm about things. When you go into brief him, Major, you better really know your topic because he's going to ask you very relevant questions. And he's very reflective on things and just doesn't jump out with conclusions or anything, but is very analytic. So my interactions with him, I have to say, have been very, very positive and in every way.
Did you see the debate?
I did.
Did anything about that, what you saw, medically alarm you?
I can't say. I think it would be inappropriate to say that, Major, because when you're just looking at someone on a one-shot basis, you just don't know what could happen. Did he have a bad cold? Did he take an antihistamine to make him, groggy or what have you? We don't know what went on. And I think it would be unfair and inappropriate to try and diagnose something from just a 90-minute clip.
Any doubt in your mind President Biden has the vigor and mental capability to carry on with this office?
In my interactions with him, I have no doubt. And I can only speak in my own interactions with him.
There's a couple things in the headlines right now, Dr. Fauci, I'd like to talk to you about. There's a headline, it was in the Washington Post this week. Dengue fever is surging worldwide. The epidemic has reached the United States. This morning, the Miami Herald reports 2 dengue fever test cases have been discovered in the Florida Keys with a CDC warning about that. What should the public understand or think about this?
Well, I mean, obviously, it's an issue. Dengue, although, most of the cases are without symptoms, a certain proportion of the cases can give you very serious disease, sometimes disease that can linger on in a chronic fashion. There are 2 aspects of dengue, Major, that you need to be interested in. Is that it's a mosquito-borne virus. It is, very prevalent in Brazil. It's a big, big problem in Brazil and in the Caribbean and in Puerto Rico. Most of the cases that we see, there are even cases in Massachusetts that are travel related. In other words, someone gets dengue from a trip to the Southern Hemisphere. They go to Brazil, they go to the Caribbean, they come back and they get sick. But the thing you have to worry about is the locally transmitted cases, because we have mosquitoes, particularly in the southern part, the southeastern part of the country. And as the weather continues to get warmer, namely global warming, the range of those mosquitoes, the Anopheles mosquitoes, the Anopheles aegyptis, Anopheles albopictus, those are the kind of mosquitoes that are endemic in the southeastern part of the country. So what you don't want is local transmission, where someone never leaves the southern part of the United States, gets bit by a mosquito from someone who comes from a southern country in the Caribbean or in South America, and then you have a chain of transmission. The way around that is to just do much better mosquito control. That becomes much more difficult when you have global warming, because the range and the duration that mosquitoes can actually function is prolonged if you have increase in temperature.
The Miami Herald story I referred to, Dr. Fauci says the 2 cases in the Florida Keys are not related to travel. They are locally based.
Right. It's just exactly what I'm saying. That's the thing you have to be concerned about, that you have a chain of transmission within your own country.
I was just on the CDC website before we logged on, Dr. Fauci, and it says for the most recent week, test positivity for COVID-19 up 8.1%, emergency department visits up 23%, hospitalizations not much changed, deaths not much changed. What is your summer evaluation of COVID-19?
Well, one thing that we realized painfully a couple of years ago, when there was a hope that this would be seasonal, like influenza, where it would peak in the winter, and then as we got to the warmer months, March and April, and certainly into May, it would essentially go to well below any level that bothers you. It's been proven season after season that that's not the case with COVID. And what happens is that you have new variants. Like right now, the newest variant is KP3, which is a derivative of multiple derivatives of Omicron. We have had so many different variants. When the weather gets warmer, paradoxically, people spend more time indoors with air conditioning. So you would think that in the winter, where people are in because it's cold, that's when you get respiratory illness. But when you have exceedingly hot weather, people spend a lot of time in crowded places indoors with air conditioning. And that's probably what's going on right now. It merely tells us that we're not going to eradicate COVID. We're not going to eliminate it. We just need to control it as best as we can at the lowest possible level. The way to do that, particularly if you're a person who has a vulnerability because of age or underlying condition, to try as best as possible to wear a mask if you're in a crowded indoor place, and to keep up on your booster shots.
One last thing. It came up at the debate. It was said that more people died of COVID in the Biden administration than in the Trump administration. That's a fact. We have about 1.2 million American deaths from COVID, just under 1.2. There were 400,000 on January 19th, 2021. Is it in any way helpful, Dr. Fauci, to view those numbers through a partisan lens?
No, I mean, a partisan lens would be totally distorting the reality of what happened. I think the real important data is to take a look at the rate and the incidence and the prevalence of hospitalization and death among unvaccinated versus vaccinated. And the difference is profound. If you look at the curve for people who are hospitalized or die among unvaccinated, it's a steep curve. If you look at vaccinated and boosted, it's much less. And what happens is that individuals, unfortunately, have made decisions about whether or not they want to get vaccinated based on ideological considerations. And, as a public health person and a scientist and a physician who does not have political, leanings, I am not one way or the other, I'm just a scientist. It's painful for me to view the fact that if you are a Republican and live in a red state versus a Democrat living in a blue state, you have a greater chance, because you're not getting vaccinated, of being hospitalized or dying. So that's the only political implication for that. It's whether or not you get vaccinated.
The voice of Dr. Fauci, the book On Call, segment 2 of the Takeout, coming your way in just 1 second.
They were very desperate about everything being fine as we entered into the end of the election cycle.
Welcome back to the Takeout. Welcome back to our conversation with Dr. Anthony Fauci. His best-selling book, On Call. Picking up where we left off, Dr. Fauci, the partisan aspect of vaccination. Jerome Adams, who you talk about in your book, served with Surgeon General during the Trump administration, was on this program, said much the same things that you've said just recently about COVID vaccinations and the efforts. But he also said, look, there are things that still rub me the wrong way. And he remembers, and many of those who are sympathetic to former President Trump remember comments of which I'm going to communicate to you. I'm going to read you a headline, September 5th from Politico 2020. Harris says she wouldn't trust Trump on any vaccine released before the election. Jerome Adams said there was a partisan aspect even before the vaccine became available in the heat of that 2020 campaign that wasn't helpful, that politicized this whole idea. Do you have any disagreement with that?
Yeah, I mean, I think any politicization of that is unfortunate, regardless of where the politicization comes from, Major. I've always felt that way. We've got to make sure we just stick with the science and make recommendations purely based on public health principles and scientific principles, and not politicize any aspect of this.
You mentioned in the book how difficult it was to maintain consistent messaging during COVID. That also became a political football. Masks, social distancing, recommendations, they evolved, they changed. And then the terminology flip-flop or lying became part of the embedded memory of COVID. Address that.
Yeah, well, you just put out a whole bunch of stuff, Major, that is related and unrelated in some respects. So let's just try and take one or two of them at a time to look at it. So first of all, one of the things that was unfortunate, but just the reality, that we were dealing with a moving target. When you're dealing with a static situation, it's very easy to get a consistent, durable message. When you're dealing with the evolution of an outbreak, that not only is the information about it evolving, namely from the beginning from China, we thought at first that it wasn't particularly transmitted very efficiently, very similar to the original SARS of 2002. And then after a week or two, we found out that it was transmitted quite efficiently. And then by the time we got to the end of January, the beginning of February, we found out it was phenomenally well transmitted and it was spreading like wildfire. That took a few weeks for us to get the real data on that. So when you're dealing with a moving target and you try to get information to the American public based on what you know at that moment, when the target moves, science, which is self-correcting, will compel you to change your recommendation. Understandably, that led to confusion because people would say, wait a minute, the scientists are telling us one thing in the beginning of January, now we're in the middle of February and they're telling us something different. It wasn't really flip-flopping. What it was giving information based on what we knew. So that's the answer to one of your questions.
Mm-hmm.
The answer to the other question that is unfortunate is that from the leadership in the beginning, Major, we should have had a consistent message. When the CDC said, we be wearing masks indoors because we now know that masks are effective if worn properly and well fitted and you get a good mask, it can protect you from getting infected and help you to not spread it to someone else. When that recommendation came out, President Trump gets up and says, it's only a recommendation, however, I'm not going to do it. Once the President of the United States says, I don't want to do it, then it becomes political, because what that is a signal that if you wear a mask, you're not with me, you're against me. If you don't wear a mask, you're with me. And all of a sudden, for reasons that should never have happened, masks became politicized. That was very unfortunate.
You talk in the book with some frequency about former President Trump's relentless optimism and his desire that people around him in this crisis sound optimistic. Impediment or advantage?
Impediment, because it was unrealistic. I mean, that's the thing. In the very beginning, when we, as part of the team, the coronavirus task force, which was led by Deb Burks, when we went to him and said, you know, we're having a tsunami of cases, So what we've got to do is we've got to really have physical distancing and have that 15-day flattening the curve and extend it to 30 days. He, to his credit, accepted that because he was hoping that, like influenza, and as I described in the memoir, Major, he kept on confusing a bit COVID and influenza. He wanted it desperately to act like influenza, which means it peaks in the winter months and then come March and April, it'll go away. So he kept on saying it's going to disappear like magic. And I kept on telling him, we have no evidence it's going to disappear like magic. But he was looking at the economy and he was looking at the election cycle and he wanted it to go away. And when it didn't go away like magic, he started to say things that were scientifically not true. Like we have a magic elixir, i.e. hydroxychloroquine, or we have other things. And that was when the situation got a bit dicey, where I had to, even though I was very uncomfortable to do it, because I take no pleasure in contradicting publicly the president of the United States. I mean, the people around him incorrectly thought I was trying to undermine him, when all I was doing was trying to fulfill my responsibility to the American public to tell them the truth, that it's not going to go away like magic. And if we don't have magic elixirs like hydroxychloroquine, and when he decided he wasn't going to believe any of that, then he brought in people who would tell him what he wanted to hear, like Scott Atlas, who came in and told him exactly what he wanted to hear. So that's when we had the tension between he and I. But in the beginning, there wasn't. We got along really quite well.
You write in the book about that conclusion made by some in the White House that you were trying to undermine the president, resulting in opposition research on you passed around by the White House against you.
That was mind-boggling, Major. I mean, I've never heard of the fact that here I am, part of the White House team, and the White House,
mind-boggling even by Washington standards, which you know are very rough.
Yes, right. By Washington standards, all of my friends in the media who I've known well over 40 years of being in my position, is almost 40 years, told me they've never seen anything like that, where the White House communications team put out opposition research, sending out information to people like you and people in the print media and people in television saying, what he's saying is incorrect. He doesn't know what he's talking about. I mean, that's never been seen before, where the White House does opposition research on one of their own people. But that's what happened.
And what did that tell you about the commitment to dealing with COVID straight up?
Well, it tells me that that reality and facts and evidence didn't really mean much. It was just getting the message across that everything is going to be okay, when it wasn't okay. And it didn't become okay for a very long period of time. They were very desperate about everything being fine as we entered into the end of the election cycle. And that wasn't the case, because things got really, really bad as we got from the summer into the fall. And we were having a lot of cases when everybody was wishing it was going away, and it wasn't going away.
That is the voice of Dr. Anthony Fauci. When we come back, since this is Independence Day week, I'm going to ask him if President Biden was premature declaring independence from the virus, at least nominally, in 2021. That's when we come back. I'm Major Garrett, segment 3 of The Takeout, coming your way in just 1 second.
When my mother died, I was on a surgery rotation in medical school, so I didn't have time to grieve.
Welcome back to The Takeout. You heard the question. Dr. Fauci, was President Biden premature in nominally declaring independence, our independence from the virus, 4th of July, 2021?
I think the key word, and I'm glad you used it, Major, is nominally. because he did say, we can be independent on Independence Day of the virus while Delta was surging. He was hoping that, in fact, as the summer came and people would be outside, that there would be a decrease. And as it turned out, the interpretation, even though he did say we were looking to get independent, but we've still got to keep our guard up, as is usually the case. I've experienced this myself. Whenever you come out with a statement and you say semicolon, however, or semicolon, but, nobody hears the but. The only thing they hear is the first part. And
Right.
everyone felt he was saying it's over, when in reality, he wasn't. He was saying, hopefully we'll be independent, but we've got to keep our guard up. But understandably, the public didn't hear the second part.
I want to talk about other parts of the book. Something really caught my eye. Page 17. Anthony Fauci, card-carrying member at one time in his life, listen closely, ladies and gentlemen, of the International Hod Carriers Building and Common Laborers Union of America. True?
Very true.
What did you do as a hod carrier, Anthony Fauci?
Well, during my college summers, between my first, second, third, and fourth year in college, I needed to get money. As I described, my father was not a great businessman, and we were not exactly doing very well in the.
He was a very generous pharmacist, possibly too generous.
Right, too generous a pharmacist when people did not pay their bills. So, although I had a scholarship in college, I really wanted to make some extra money. The easiest way to do that was to get a high-paying job. And I was able, through the influence of a friend, get
a well-placed friend with a nondescript and never really thoroughly investigated job within the union to land you a position.
Yes, and what I did is I worked as a common laborer, mostly in demolition and construction, where most of what I did was essentially be, either a hod carrier, which means you on a wheelbarrow, put some of the cement for a bricklayer, or you just carry away debris when you're demolishing a building. So it was very hard labor for 3 summers, but I did it as a member of a union.
What did it teach you?
Well, it taught me a lot of things about when people are really working hard physically. That's tough. And I think one of the things that I'm realizing now is I'm getting older, quite old, actually. I'm in my early 80s, is that you have to have some sort of security for those people who, when they reach a point in life when physically they can't do that kind of work. So I've become a real advocate for the common working man. And I've always been that way ever since I had that experience. I grew up in a working class neighborhood in Brooklyn, and I spent, 3 summers working as a common laborer. So I know what that means.
Something else that comes up thematically in the book, Dr. Fauci, and that is dealing with adversity. The first episode of it is when you are told your mother is suffering from a very serious liver ailment and is quite likely to die. And you write, for the first time, I was thinking about my mother, both as a son and a physician. She dies 8 weeks later, and you say, I stuffed my painful feelings down deep. Later in the book, you write, those feelings can be stuffed down for only so long. One of the themes in the book is you stuffing down feelings. Was that a good strategy?
I don't know whether you want to call it good or bad, but it seemed to be necessary at the time in order to function in the very difficult job I was in. I mean, when you're responsible for the lives of other individuals as a physician, when my mother died, I was on a surgery rotation in medical school. So I didn't have time to grieve. I mean, literally the day after we buried her in Greenwood Cemetery in Brooklyn, I was on call in the operating room. Yeah. So I couldn't all of a sudden, have a grief day because I was responsible for the health of another person. That was even more dramatic during the early years of HIV, when I was primarily responsible as the physician for a large number of mostly young gay men with this terrible disease that did not have a treatment and early on did not even have a cause. So when you were, semi-traumatized by seeing all of your patients die one after the other, you just could not, get into the point of letting that influence your ability to treat them and to care for them. So that's
You
what you do when
you
you suppress that.
you write in the book that those were your dark years, the AIDS years, and you describe the pain, suffering, fear of those patients and the family members around them as unimaginable.
Yeah, it was because it was somewhat unprecedented that a disease that was mysterious, that didn't have any therapy, that seemingly selectively attacked young, otherwise healthy gay men. Um, it was just horrible. It was when I say unimaginable, it was because it was one of those situations where you never want to say hopeless when you're dealing in the field of medicine. But at that time, when you see almost everyone, with some exceptions, but almost everyone suffering and dying a terrible death at a very young age, that was quite traumatic to everyone involved.
You write in the book about several patients, one in particular, Ron Rinaldi, who from one round in the morning to a round later in the afternoon practically falls off a health cliff.
Right. That was very emblematic of the kinds of things. I mean, I gave that as one example. And as I mentioned in the book, Major, that was like one of hundreds. And it was a typical example. He was a young man who had HIV and he had one of many opportunistic infections. And one of them is called cytomegalovirus, which happens to target the retina, and people lose their vision because it chews away the sight elements of the retina. And he was one of our patients. He was a terrific young man. We would make rounds on him. He had a very upbeat attitude, and he was gradually losing his sight. And even though we were treating him with an antiviral drug, it wasn't working as well because he still was profoundly immunocompromised. And the story I tell is that we made you make regular scheduled rounds in the morning and in the evening. But if a patient needs you during the day, obviously you're always there. And sometimes you're there all day with the patient. But we made rounds in the morning. And when I walked in, he said, "Hi, how you doing? Good to see you." We had our usual conversation. And then when we made rounds in the evening, I walked in and he looked at me and said, "Who's there?" Which means he had essentially gone blind for the last remaining part of his retina that wasn't destroyed by the virus. In that 7-hour period between rounds, he essentially lost all his vision. That was very traumatic for everybody, including me and my colleague physicians and nurses.
The voice of Dr. Anthony Fauci, the book On Call. It is a bestseller on the New York Times list. It is a bestseller on Amazon. When we come back, we're going to talk about other component parts of Dr. Fauci's career: Ebola, Zika, SARS, and the like. I'm Major Garrett, segment 4 of The Takeout, coming your way in just one moment.
Following 9/11 and the anthrax attacks, the country was in a state of high tension.
Welcome back to The Takeout. I name-checked several other medical situations in which Dr. Fauci played a very prominent role in American life. I did not mention anthrax. I'm going to mention that now. And I want to quote to you, Dr. Fauci, from your book, page 179, the book On Call, talking about the stresses of anthrax. And I want you to remind my listeners and viewers what that was like in 2001 after the 9/11 terrorist attacks. but you talk about a particularly fraught moment for you, early in the morning, about 2:30 or so. I walked a short distance toward my car. This is on the NIH campus. Suddenly, without warning, I broke into tears. It is a good thing that it was the middle of the night, because I would have been terribly embarrassed if any of my colleagues had seen that. However, after about a minute and a half, I felt fine, and the brief outburst reminded me that indeed I could still express genuine human emotions despite a job that required that I remain as cold as ice. Why do you have to remain cold as ice?
Well, when you're in a responsible position of having to make decisions that are going to impact a lot of people, namely the people that you're responsible for, particularly the citizens of the United States who are trying to make policy and figuring out what was going on with these anthrax spiked letters that were sent to the media and to also certain senators, Senator Leahy and Senator Daschle. And at that time, the tension, Major, was so intense, it's difficult to describe. And you're responsible for, developing countermeasures in case Al Qaeda is going to come out with a big bioterror attack. Now, when you look back on it, it's clear that was a homegrown terrorist that put some anthrax spores in a letter. But at the time, following 9/11 and the anthrax attacks, the country was in a state of high tension that the next moment we were going to have an explosive bioterror attack. That's what I meant, that I had been up, like maybe sleeping 3-4 hours a night for a couple of nights in a row, and I was exhausted. And that's what happened when I left my office and went into the parking lot at 3 o'clock in the morning. I guess it was just exhaustion that caused me to have that very brief release of tension.
Any advice you have for those in your profession about how to balance mental health, the internal emotions, and the obligations of the work?
Well, yeah, I mean, as I've told so many of my friends and colleagues who ask, I'm not exactly the poster child for a normal work-life balance, as my family often reminds me. But my advice to people in the medical profession, but in any profession that has a high degree of stress and tension, you've really got to take care of yourself, because if you wear yourself down, and you may wind up having the paradoxical effect of not doing your job as well as you can do it. That's
Simone
important.
Biles just made the U.S. Olympic team as a gymnast for the third time. She's 27, the oldest American ever woman to be on the Olympic team. She said that after Tokyo, where she took herself out of events because she was not in a mentally comfortable place to perform and compete at the highest level, she said she deals with her therapist every Thursday and treats that religiously. Generally speaking, therapy a good advice?
Well, it certainly, if it's for you and you feel it would help you. I had the world's greatest therapist, my wife, and it was free.
A compliment to Christine for sure. But without getting too personal, have you ever thought about that or consulted?
No, actually, I mean, of course I've thought about it, but one, I didn't have time for it, number one. And number two, I had a very good support structure. I mean, I'm being a little facetious when I said I had the greatest psychiatrist in the world, but I had Christine, who is a nurse, before she became the head of the bioethics department at the NIH. Very insightful, understands me very well, and really helps me to get regrounded when it looks like I'm getting stressed out. So I was fortunate. But if you don't have that, I see nothing wrong with, if therapy can help you the way it helped the gymnast. I mean, it was very important for, because look at her now. I mean, she's at the top of her game again.
Exactly. So we've got 3 minutes. Ebola, Zika, SARS. Take them in whatever order you prefer and say whatever you wish to say about them that you want people to remember.
Well, Ebola is an interesting disease. It devastated for a while 3 West African countries. There was more fear of it in the United States than there was reality of a problem. I think what people didn't understand, but you can, I guess, appreciate their anxiety because they would see pictures in the newspapers of the West African countries, bodies on the street, people dying a terrible death, without appreciating that the only way Ebola is spread is by direct contact with body fluids of a very sick person. It is very different than a respiratory-borne illness such as COVID, which is spread merely by somebody breathing next to you by aerosol. So there really is no threat that there would be an Ebola outbreak, yet there was fear that was a greater issue than the actual threat. Zika, interesting. It relates a lot to what you asked me earlier, Major, about dengue, in that it's a mosquito-borne illness. And if you don't have mosquitoes biting you, you're not going to get sick. So that's pretty easy to figure that one out. And in the United States, it was really well controlled by mosquito control in Florida and in Louisiana and in Mississippi, where you had the threat there. Well, SARS-CoV-1 was the predecessor of COVID. And the difference was that it was easily suppressed by good public health measures, identification, isolation, contact tracing. In 2002, there were about 8,000 cases, 785 deaths, but it was very different than SARS-CoV-2, which was actually a very highly transmissible virus.
Wow. I didn't think that was possible, Dr. Fauci. We've got 45 seconds left. Does it matter if COVID-19 was from a wet market or a lab?
You know, in some respects, no. We need to be making sure that in the future, since we will not ever know definitively, that we need to put into place things that would, systems that would prevent it from happening again, regardless of what the origin is. Safety concerns when you do experiments, good guardrails for that, as well as really taking a close look at the animal-human interface, because most evolutionary virologists believe that just like most other new viruses, that they're zoonotic and they jump from an animal to a human, that probably we should make sure we are much more strict in the control of the animal-human interface, particularly in wet markets.
The voice of Dr. Anthony Fauci, the best-selling book On Call. Dr. Fauci, his 5th appearance on the Takeout, I'm happy to say. Always a pleasure, sir. Stay tuned for your Takeout Outtake Especial. That's next.
Stigmatizing people who are afflicted with a disease goes back historically for centuries, and it didn't disappear with HIV.
Welcome to your Takeout Outtake Especial. Our special guest, Dr. Anthony Fauci. We've done a lot of the fun and game stuff in other episodes, Dr. Fauci, but many of my listeners and viewers are of a young enough age to where they think of AIDS and HIV in a way where there is therapies and there are means by which to deal with it. They may not know just how terrifying it was in its origins, or even understand the names that we now are comfortable with and feel like we understand. Help my audience remember what GRID was and what HIV and what AIDS and the names of it, how important it was to actually have a name and a comprehension of what the world was seeing.
Yeah, in the beginning, it was incorrectly felt that it was totally a disease of gay men. And it was called GRID, which was a very inappropriate designation, a gay-related immunodeficiency. Another name was gay cancer because of Kaposi sarcoma. What we didn't fully realize, because we were seeing a small window into the disease because it was predominantly among young gay men in the United States, and to some extent injection drug users, and to a lesser extent commercial sex workers, that in the rest of the world, HIV was Most of it was in the developing world, 90%. 67% was in Southern Africa. And in those circumstances, it was mostly heterosexually transmitted. So as the years went by, we went from a mysterious disease with strange names to finally getting a name that best described it, acquired immune deficiency syndrome, that was then found to be caused by a very specific virus, which fortunately we now have very, very good treatments for.
In those early days, homophobia clouded these judgments, did it not?
Well, homophobia and stigma absolutely was, not only clouded judgments, but it's the enemy of good public health in any disease, certainly manifesting itself with HIV. How stigmatizing people who are afflicted with a disease goes back historically for centuries, and it didn't disappear with HIV.
I mean, there were those who were saying it was God's revenge.
Yeah, really terrible to say that, to blame someone who's been afflicted with a disease that's revenge for something is just, it's horrible.
And it delayed Reagan administration conversation about it, did it not?
Yeah, one of the things that I describe in the book about, I dealt with seven separate presidents, but one of the issues that was very difficult is that President Reagan, with many good qualities that he had, did not use the bully pulpit of the presidency to call attention to this emerging outbreak, and didn't even mention the name AIDS until his second term, which was really in many respects inexcusable since this was an emerging major outbreak.
Dr. Anthony Fauci, it's always a pleasure, sir. The book, again, On Call. It's a bestseller on the New York Times and Amazon. Doctor, thanks for the time.
Thank you very much, Major. Always great to be with you.
We'll see you next week, folks.